Otorhinolaryngology is a specialized field of medicine that focuses on the diagnosis and treatment of disorders of the ears, nose, and throat. As medical students, it is essential to build a strong foundation in the understanding of various conditions related to the ear. In this comprehensive script, we will delve into the intricate details of otitis media, a highly prevalent condition affecting individuals of all age groups. To understand the pathology of otitis media, it is crucial to grasp the intricate anatomy and physiology of the middle ear and the eustachian tube. The middle ear consists of the tympanic membrane, ossicles, malleus, incus, stapes, and the oval and round windows. The eustachian tube connects the middle ear to the nasopharynx, allowing equalization of air pressure and drainage of secretions. Understanding the mechanics of these structures is vital in comprehending the development and complications of otitis media. Numerous risk factors contribute to the development of otitis media. Age is a significant factor, with higher incidence rates observed in children, particularly those under the age of 3. Second-hand smoke exposure increases the susceptibility to otitis media due to its detrimental effects on the eustachian tube function. Allergies, such as allergic rhinitis, can also lead to the development of otitis media by causing inflammation and obstruction of the eustachian tube. Recognizing the characteristic clinical presentation of acute otitis media is crucial for accurate diagnosis and appropriate management. Patients often present with otalgia, hearing loss, otorrhea, and fever. However, it is important to differentiate acute otitis media from other conditions like otitis externa or serous otitis media, as they require distinct treatment approaches. A thorough understanding of differentiating features will aid in providing optimal care to patients. Infectious pathogens play a significant role in the development of otitis media. Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis are the most commonly isolated bacteria in this condition. Understanding the microbiology behind otitis media is crucial in determining appropriate antibiotic therapy and preventing complications associated with the infection. Appropriate antibiotic therapy is pivotal in the management of otitis media. The choice of antibiotic depends on several factors, including the age of the patient, severity of symptoms, and prevailing antibiotic resistance patterns. A comprehensive understanding of the principles of antibiotic therapy will enable medical professionals to make evidence-based decisions and optimize patient outcomes. In cases of recurrent or persistent otitis media, myringotomy and tympanostomy tube insertion may be necessary. This surgical procedure involves creating a small incision in the tympanic membrane to facilitate drainage and ventilation of the middle ear. Understanding the indications, surgical technique, and potential complications associated with these procedures is essential for offering appropriate interventions to patients. Otitis media can lead to various complications that can significantly impact patients' overall health and well-being. Mastoiditis, a potentially life-threatening condition, occurs when the infection spreads to the mastoid bone. Hearing loss can result from chronic fluid accumulation, damage to the ossicles, or sensory neural complications. Other complications include tympanic membrane perforation, which may cause persistent otorrhea and hearing impairment, as well as the development of cholesteatoma, a destructive lesion requiring surgical intervention. Biofilms play a crucial role in the pathogenesis of chronic otitis media. These complex communities of microorganisms, encased in a protective matrix, contribute to the persistence and recurrence of infection. Understanding the impact of biofilms in chronic otitis media is essential to design effective treatment strategies that can eradicate these resilient structures and prevent long-term complications. Recurrent acute otitis media poses a significant challenge in clinical practice. Various management strategies, including prophylactic antibiotic therapy, immunization, and lifestyle modifications, have been recommended by current guidelines. Familiarizing ourselves with these guidelines will enable us to provide evidence-based care to patients with recurrent acute otitis media and reduce the burden of this condition. Although bacterial infections are commonly associated with otitis media, viral infections also contribute significantly to its development. Viral pathogens, such as respiratory syncytial virus and influenza viruses, can cause inflammation and compromise eustachian tube function, predisposing individuals to bacterial superinfections. Understanding the role of viral infections in otitis media is crucial for appropriate management and prevention strategies. Advances in diagnostic techniques have revolutionized the diagnosis and management of otitis media. Pneumatic otoscopy allows for the assessment of tympanic membrane mobility, aiding in the differentiation of different types of otitis media. Tympanometry measures middle ear pressure and compliance, providing valuable information about eustachian tube function and the presence of fluid in the middle ear. Familiarity with these innovative diagnostic tools will enhance the accuracy of our assessments and guide appropriate treatment decisions. Children with a history of otitis media may develop auditory processing disorders, which can affect their speech and language development. Understanding the impact of otitis media on auditory processing is essential for early detection, intervention, and the implementation of appropriate support strategies. By addressing these auditory challenges, we can optimize the long-term outcomes and quality of life for these children. In conclusion, otitis media is a complex condition that requires understanding its anatomy, causes, symptoms, and treatments. As future healthcare professionals, it is essential to stay updated with the latest research and guidelines to improve patient care and outcomes.